Hello everyone, this is Health Angel Solutions again. Today we'll discuss why some thyroid patients experience worsening symptoms when using prescription drugs like Synthroid and levothyroxine. Why in the world would thyroid patients experience worsening symptoms while taking the very drug that is meant to help them feel better? It's not as complicated as you may think, so let's talk about it. I have three primary reasons why this can happen. And the first is probably the most significant. As I mentioned, it's not as complicated as it might seem. So listen to me as we discuss this. The first reason is related to the way thyroid medication affects your body's normal thyroid system, which may be suppressing the amount of Thyroid your body is producing naturally. To explain this, let me discuss normal thyroid physiology. In a healthy thyroid, the thyroid gland produces both T3 and T4 in response to a hormone called thyroid-stimulating hormone, which means that your thyroid produces about 80% T4 and about 20% T3, so it's producing both at the same time. However, when you take thyroid medications like levothyroxine and Synthroid, your body's ability to produce thyroid hormone is altered because they suppress the amount of thyroid hormone that is produced. In effect, they are stopping your body's natural thyroid hormone production mechanism. What you should know is that levothyroxine and Synthroid only contain T4, so you are replacing that produced by your body with 100% T4. Because that's what's in thyroid medications, levothyroxine and Synthroid only contain T4 thyroid hormone. When you take them and put them in your mouth, they feed back to your brain, which is where Ch is produced in the pituitary gland. Once you do that, your brain stops communicating with your thyroid gland and tells it to produce both T3 and T4, instead telling it to produce 100 T4 instead. So why is that a problem? Well, it turns out that this T3, which you're only about your body produces about 20 of this. However, this is about 200 times more active than T4, so when you take thyroid medication, you are suppressing the most active thyroid hormone in your body by far and replacing it with inactive T4. This means that your body must convert that T4 into T3, and the reason it does so is because it recognizes how important T3 is. You know that every day without your conscious awareness, your thyroid simply pumps out a small amount of T3 just to keep you healthy, so that your tissues and cells receive the necessary amount of T3, while also producing a significant amount of T4 more than it does T3, as it is aware that your body can use that T4 and convert it into T3 as needed depending on the demands of the cell, and you are aware of whether you are exercising or if any adjustments are required. Now, however, you are replacing those 20 with 100 and another 20 of T4, bringing the body's total T4 production to 100. Your doctor will reply, "Hey, I know that this is happening. However, we are sure that your body will be able to convert that T4 to T3, but that doesn't happen for many people. So what happens is that you're suppressing that T3 in favor of more T4, which frequently makes you feel worse and causes more hypothyroid symptoms. Some people will take Synthroid and levothyroxine, and they'll start to gain weight, experience more hair loss, and have worsening hypothyroidism symptoms. They'll ask how this can happen. Physiology is what this is. Thyroid physiology 101. This is what happens to some people because, as it turns out, about 20% of people are not very good at converting from T4 to T3. Giving them T4 just gives them more of the same thing that they are unable to convert from T3, which only makes the issue worse. Okay, so that's number one, but we're not done yet. There are actually a few more. The second is that occasionally the medication contains inactive ingredients that can cause an allergic reaction, which we'll refer to as an allergy. It could also be regarded as a sensitivity, since the truth is that some of the ingredients in thyroid medications, like levothyroxine and Synthroid, are not the T4, they also contain inactive ingredients. One of these ingredients is lactose, which is found inside as an active ingredient in some of these medications because of the way they are prepared. You may be reacting to the lactose, so when you take your medication, you're getting the right hormone, but in some cases, it might be right for you. However, some people, let's say you don't have this issue, you take T4, and you might feel better otherwise, but you're putting lactose, let's say you have lactose intolerance, into your body in the form of a pill, and you're wondering why you have several different kinds of reactions or why you don't feel well. There are a lot of other inactive ingredients, such as cellulose and other fillers, binders, and other things like dyes, by the way. Therefore, if you have an allergy or don't react well to certain dyes, this could also be a contributing factor. I didn't cover all of these here, but I want you to know that even though the medication contains the active ingredient, the inactive ingredient may be making you react negatively as well, so you should pay close attention to that. Now, let me go back to number 1 to discuss the solution, which is to take 3 with your Thyroid. If you made it this far into the video, thank you. These videos take a lot of effort and time to make, so if you enjoyed them, please hit the like button, subscribe to the channel. This goes a long way in helping us grow. That said, back to the video. If you're having trouble with number 1, the solution is to go and get a cleaner version of thyroid medication. There are many cleaner versions of thyroid medications available right now that are free of these binders, fillers, and dyes that you can simply switch to. It's very easy to do this instead of trying to replace 100 of the thyroid loss with the inactive thyroid hormone. Try to get a ratio closer to 23 and 20:4, and you can do that by combining thyroid medications. Thus, consider switching to tyrosine if you're not reacting well to, say, levothyroxine. There aren't many options for people on net, at least not at the time of filming, so that may be a little more difficult. But there are always options available if you're on levothyroxine or Synthroid, which is number 2. If you're not responding well to another type of NET, like Armour Thyroid, try switching to a different one or trying switching to a compounded version of natural desiccated thyroid. Therefore, I want to stress what that means in this context because it is generally unlikely that when your doctor prescribes a dose of thyroid medication that is, say, 75% of the dose you require, they will never get it immediately. When your doctor prescribes thyroid medication, it is never going to be the case that that is the dose you require. I shouldn't say never, but it is extremely unlikely that, for example, when your doctor prescribes 100 micrograms of levothyroxine, that is the dose you require. It's much more likely that they will give you a dose that is slightly lower or slightly higher, and they will adjust it over the course of the next few months until they find something that works for you. However, occasionally they will look at your lab results and decide that since your lab results aren't too bad, they should start you on a very low dose. Assume, for example, that you were prescribed 25 micrograms of levothyroxine, but that you actually required 150 micrograms. In this instance, your doctor gave you a relatively small dosage, which is suppressing your thyroid gland up top, and then you're just feeling worse automatically because you're getting less thyroid hormone instead of more. This has nothing to do with the T4 to 3 ratio. It simply means that your dose is completely off. This does happen, but it's not very common. It's much more likely that number 1 is affecting you if you're taking medication and you're feeling ill, and or number 2. I would actually say that this one is fairly common as well, and number 3 does occasionally. For example, when someone says, "Hey, my doctor prescribed a dose of," I'm not sure why, but I started feeling worse after taking 25 micrograms of levothyroxine and 5 micrograms of T3. Usually I reply, "Well, that is an incredibly small dose. Therefore, that's probably the cause of that." Though it's not very common, it can happen occasionally, so keep that in mind. These are the top 3 reasons why thyroid patients experience worsening symptoms after starting thyroid medication. In conclusion, if you're feeling worse on thyroid medication, it's essential to understand that you're not alone. Many people experience similar frustrations. It's crucial to remember that managing thyroid health is a complex process and can vary significantly from person to person. Factors such as medication type, dosage, timing, and even interactions with other medications or supplements can play a pivotal role in how you feel. Additionally, lifestyle factors like diet, stress, and sleep quality can also influence your overall well-being. If you find that your symptoms persist despite treatment, don't hesitate to reach out to your healthcare provider. They can help you reassess your current regimen, explore alternative medications, or investigate other underlying issues that might be affecting your health. Remember, you deserve to feel your best, and finding the right balance may take time and patience. At Health Angel Solutions, we're dedicated to providing you with the latest information and support on your health journey. If you found this video helpful, please give it a thumbs up, share it with anyone who might benefit, and subscribe to our channel for more insights and tips on managing thyroid health and overall wellness. Together, we can empower ourselves with knowledge and take control of our health. Stay informed, stay healthy, and remember that with the right approach, you can feel better and thrive. Thank you for watching, and we look forward to seeing you in our next video.